Hi my beauties, welcome back to Younger. Today I'm going to be talking about thread lifts. So the reason why I wanted to talk about thread lifts is a lot of people come into my clinic wanting Botox or filler, sometimes laser, sometimes energy-based devices, and a lot of times people ask about thread lifts, but they don't really know what that really entails or what the result will be like or what the downtime is like or what the outcome is or what to expect. So I just wanted to kind of go over thread lifts in general because they're gaining a little bit more popularity now. They were first kind of launched a couple years ago, and then there were some issues with it, and now a lot of the companies have modified the approach and the configuration of the actual thread itself, and so a lot of those problems have now been eliminated and it's gaining popularity once again. So everything in medicine and aesthetics kind of comes in waves, and sometimes different treatments will come out and they'll have an issue and they modify it, and this is a common theme. So before I move on, I ask that you like, comment, and subscribe and share this video with anyone who may find it useful. So what the thread lifts basically do is it's almost like a string type of filler, and it does provide a non-surgical facelift or brow lift or neck lift. And so what happens is usually patients who need like a little extra pull or pulling up, but they don't want to have surgery, they don't want to go under the knife, they don't want to have general anesthesia, and they kind of want a minimally invasive procedure, but something a little bit more than a tightening device or laser can give them. That's when thread lifts are indicated. Now the most important thing is to go in a protocol and a very arranged algorithm with the method in which you introduce the thread lifts into a patient who has never had any procedures done before. Sometimes you reserve thread lifts for a downstream treatment after you optimize patients with fillers and other treatments first. So if someone comes in and they have a lot of laxity because they've lost volume in the midface, which happens in our 30s, 40s, 50s, and beyond, when they have loss of volume, the hyaluronic acid, the fat pads, the hyaluronic acid decreases, the volume decreases, our fat pads kind of thin out and have less volume, and even we get bony resorption. When we lose volume in the midface or in the forehead or in the neck, the skin starts to fall and sag. So I say this all the time, and I'm sorry if I'm being redundant, but skin is like a tablecloth, and the table underneath starts to thin out and the tablecloth starts to hang. So you want to build the table back up or lift up that tablecloth to kind of put it right where it was before. So when we see patients who have never had any filler and they come in and they want either a facelift or they want a minimally invasive thread lift, usually we want to optimize gaining that volume first before we do the thread lifts. And the reason is if somebody has very thin skin and a lot of volume loss and you put the thread lifts in, you want to optimize the filler first, because once those threads are put in place, you don't want to go in there with a needle and get filler down the line. I mean, you can, but it's better to optimize with fillers first and then do the thread lift. The other reason for that is because if you have hardly any volume here and you have the thread lift going through, you can sometimes, when it's not done correctly, I have to say, when it's not done correctly by an experienced provider, you can actually see the tethering or the pulling of the threads in the face, and that doesn't look good on anybody. I 100% guarantee you that would never happen with me, but sometimes if you go to some providers who may not have that experience, or they're kind of YouTubing it or going to a weekend conference somewhere and learning how to do it or getting trained by the actual company without the groundwork and the experience, you can get those bad outcomes. So if you do have a thread lift, go to somebody who's experienced and look at their before and afters. I mean a lot of before and afters, and their own before and afters, not ones they pulled off the web, ones that they had actually performed themselves and with the outcomes. So usually when somebody will come in wanting a non-surgical optimization or lifting, tightening, and pulling, we do filler first, and if they've already had filler or they've already done that or tried it, or if they don't want to have filler, then we can move to the thread lift. And so what happens is the threads are basically inserted very delicately, just with some local anesthetic. You're awake, alert, and oriented, and you're talking to your provider while you're having it done. And they basically get inserted into the face. Now, sometimes you could do one thread, sometimes you could do 2, 3, 4. And what they do is it basically lifts up and pulls up on that skin. In addition to that, having a mechanical kind of retraction or pulling up of the skin, what it does is it's almost like a string-based filler. It's like a slow deposition of filler. So, for example, Nova threads, which I really like, and I've had almost 100% happy patients with that procedure. NovaThreads are polylactic acid, which is the same substance and molecule that Sculptra is. Sculptra is an injectable filler, and it's a stimulant filler that stimulates your body to make volume. Hyaluronic acid, collagen, elastin, all these things that get depleted as we get older and make the skin sag, it replenishes that, and it stimulates your body's own regenerative processes to synthesize that. So when you have this strings in place, not only is it lifting and pulling, but it's also releasing a slow deposition of like a filler effect where it's stimulating your body to make volume. So it's a win-win situation. And usually patients, I'll see them back after the threads are placed 1 week later, and they look pretty good, but they really look good like 2 to 3 months later. Now, the mechanical pulling up happens right away, and you notice that result, and you'll notice an improvement. But as time goes on, something happens with the string-based filler in the skin that stimulates your body to make volume, and people just always look so good about 2 to 3 months out, and it usually lasts 2 to 3 years. So the anecdotal studies have been, showing us that it does last 2 to 3 years. Now, 3 years later, you may be 3 years older, but you may need them again, or you may at that time want to jump to surgery. But it's a perfect kind of holding spot for people who are wanting an improvement, but they're not quite ready for surgery, and they want to do something in the meantime to make themselves look good. So what happens is we usually mark out the 3, say we're doing 3 strings, we'll do local anesthetic in 3 different areas, and we basically it's like a needle kind of with a string on it, and you basically put the needle through the skin, and then you basically pull up on the string and you cut it, and then you massage it into the skin. So it sounds barbaric, may sound scary, but it's actually a very easy procedure to do when you know what you're doing. And I'm a Mohs skin cancer surgeon, so I know the planes of the skin very well. I always have happy patients. It's always placed it's pretty much effortless, and it just goes along the plane of the skin, and the patient's numb and comfortable. They're awake, alert, and they're talking to me about their day or what they're doing for the holidays, and it's usually not a big deal. When they leave, they may be a little bit swollen, feeling a little bit numb. Sometimes you can have bruising, but if you take your arnica or bromelain, which is derived from pineapple and minimizes your bruising, and you stay off your aspirin and your fish oil and things that can thin your blood, usually bruising is not even an issue. Patients leave looking great. The recovery time is very minimal. We say that you have 1 week of not chewing gum, not exercising or exerting yourself with strenuous physical activity, and also not biting into something big like a big sandwich or a hamburger. We have you kind of minimize your facial movement until the strings get kind of settled into place. But it's not scary. It may sound scary, but it really is a very light and easy procedure with really a dramatic outcome. And a lot of my colleagues do it regularly. I do too. Patients are always happy, and there's minimal downtime and discomfort. Doing it in the neck is also a really important place. Usually we just put the strings in through this area of the neck, and we can pull up. We can do it in the face, pull up this way. And again, for the brow lift, we do this to kind of lift up on the brow. Patients are always very happy. Again, minimal downtime. Now, there's a lot of different thread companies. NovaThreads are the ones that I use myself, but I'm actually going to be looking into a couple different companies that have kind of push the envelope with their engineering and the technique and the type of thread material that they use. So it's a constantly evolving field in dermatology, aesthetic dermatology, and I always want to keep up, be in the know, and see if I think that it's a good adaptation to incorporate a different type of thread. But for right now, NovaThreads are my favorite. And InstaLift, which you may see if you do your online research, is kind of it's also a great technique, but it's just a little bit different. And I started outside of my fellowship doing InstaLift. I liked it. I had great results, but I now incorporated NovaThreads. It's not to say that one is better than the other. Just from my personal opinion, I like the NovaThreads the best. And I think that people who are not looking for surgery but looking for an improvement in their skin, it's one of the best things that you can do. Usually afterwards, the face will have a better, smoother contour. Everything will be lifted and kind of lifted up in this vector and direction, and you can't ever see the threads. You can't see bumps. You can't see the lines. So if you Google it and you find these horrible outcomes, that's usually when it's done by somebody who probably shouldn't be doing this, and having an aesthetic and surgical background makes all the difference in the world. So usually it takes about 30 minutes in the clinic. You come in, you have your little local injections, put the threads in, kind of massage them into place, you walk out, you can go along without your day, just minimizing your extraneous physical activities for about a week. You come back for follow-up, everything looks good, and then over the next several months you'll look even better, and that'll last for about 2 years. So hopefully this answers any questions that you guys may have generated from your research, and I'm here to answer questions in your comment section as well, and I'll be posting on Instagram doing thread lifts as well. Hope this helps you guys.